Hello, everybody. How are you? It's Jennifer, the Keto RN, and I am so excited to have you guys here. As you're popping in, say hello. I'm coming from Spokane, Washington. As always, we're having gorgeous weather today, and I am so fortunate that my good friend stopped by today. How long have we known each other? Since 2003?
Yeah, 20 years.
20 years. Gosh, we're that old. We were in our 30s when we met. All right, sorry, I'm trying to get this angle right. So, anyway, Kim is here. She now lives in Idaho, but she is a good friend of mine. She came up for a conference, and I'm lucky enough to get her for a whole night. And I thought it would be super fun for all of you to hear from the experts. Kim's a family practice doctor. Where's your clinic?
In Lapwai, Idaho.
Idaho.
On the Nez Perce Reservation.
On the Nez Perce Reservation. Yes, that is so awesome. And how long have you been practicing?
Medicine?
Yeah.
16 years.
16 years. I've known her for a long time, since before she was a doctor. I can't even
Well, no, I was a doctor when I met you.
Right. You were in residency. Sorry. She graduated from medical school, but then she got her practice, and it's so awesome. I'm so proud. So we're going to talk about insulin resistance, which, if you guys have followed me for a while, you know I talk about it a lot because it's important, and understanding insulin resistance is really a huge key in your overall health. So on average, Kim, how many are you Dr. Hartwig to me now? She's Dr. Hartwig. How many, what do you think the percentage of your patients are that suffer from insulin resistance?
Okay, so I practice on the Nez Perce Indian Reservation, and you may know that natives have a higher incidence of diabetes. Mm-hmm. So totally different practice setting than something that you might see here in Spokane. My practice in Spokane did not have nearly as many people with insulin resistance, mm-hmm. but I would say that probably 80% might be a little bit high, but I wouldn't go less than 75% of my patients have insulin resistance in my current practice.
Wow. So how do you educate your patients on what insulin resistance is?
I explain that insulin resistance is that your pancreas is tuckered out. Mm-hmm. You and I can work overtime for so long,
right,
and your pancreas gets tired of working overtime all the time. And insulin resistance is if your pancreas needed to secrete this amount of insulin to cover a meal or a stressful situation. With resistance, your pancreas needs to generate this much insulin, so it has to make more because right, your body does not respond to the insulin that it's making. And so that's what resistance is, that your pancreas, which makes the insulin, has to generate more of it, and it makes it more tired, and the cycle just propagates itself.
So I have talked to my followers about sort of it being like a worn down car. Like you drive your car, you drive it and you drive it and you drive it, and you don't take care of it, and eventually it just peters out. And then you're putting all these, more oil in it, or, trying to make it better. That's just kind of the most simple way that I can describe it. And it mm-hmm. sounds like I am right. Let's see. What does Donna say? I am 68. I have a terrible time losing weight, and I drink the ketones. Yeah, do you have type 2 diabetes? Donna, you can answer that in the comments. All right, so besides diabetes, because we all know insulin resistance can lead to type 2 diabetes, how does it show up in our bodies before it's type 2 diabetes?
So you might have a condition called acanthosis nigricans, where you get this black patch of skin on the back of your neck. Mm-hmm. You might have polycystic ovarian syndrome.
Yes.
You might have excess weight contributes to it. I mean, your adipose tissue or fat tissue works against your insulin. So the more weight that you carry, the more insulin your body has to produce. So those would be clinical signs that we would find that might indicate that you have some resistance. But there isn't a clinically applicable test. We don't check
Right.
insulin levels generally. We'll see the clinical symptoms, such as I mentioned, that might contribute to resistance, and one that's recognized, and we need to do something to prevent you from getting diabetes, because diabetes is totally preventable. People think that, well, my parents or my siblings or my grandparents had diabetes, so I'm going to get it. Well, no, that's not the case. It's preventable, and we need to do things so that we don't progress to diabetes.
Right. That's true. So what then how do you counsel your patients? What is the best prevention, even before, maybe you are diagnosed with type 2 diabetes? What is the best prevention and the best advice that you give all of your patients who might be struggling?
Well, the most important thing for us to do is to move. Insulin is the key for the energy to get into our cells. And then that energy is sugar. Everything that we eat, whether it's protein-based, carb-based, fat-based, anything that we eat gets broken down into sugar.
Right.
And insulin is the key that lets the sugar into our cells.
Right.
And we need insulin to get the sugar into all of our cells except muscle cells. Muscle cells can absorb or access the sugar without needing any insulin. So movement is really a very important key to combat insulin resistance and diabetes prevention and non-alcoholic steatohepatitis, which is fatty liver disease.
And what did you say about fatty liver disease? It's the number one, like the non-alcoholic fatty liver disease is the number one reason nowadays for
liver transplant.
And it is 100% preventable.
Absolutely.
Wow. That's amazing.
Yeah. We're eating ourselves to death.
Those words are so powerful. I mean, I think I've said that sort of, but never really like that on here. And I think that's just, I mean, did you guys hear that? Like, we're eating ourselves to death because our food is so poorly made, and basically packaged with more ingredients than it needs to be, than it needs to have.
In the whole energy process, we have 3 sources of energy.
Right.
The food that we take in.
Yes. That's number 1, the food that we take in.
Number 2 is our liver. So our liver has stores that can be mobilized very quickly. When we don't have energy readily available, then our liver can cleave or cut long sugar chains for us to have sugar available, which is the energy for our bodies, have that available very, very quickly. And the last source is ketones, which our fat cells hold. And when our fat is broken down, the biochemical process is that eventually becomes sugar as well. But there are so few times where we actually go long enough for our liver energy to be metabolized, because we're eating all the time. And that process of eating stops the liver metabolism, stops the fat metabolism, and so we propagate the resistance by eating. But our bodies are made to use all 3 sources of energy, and we really don't in today's day and age.
We don't. No, because there's food available 100% of the time, 365, 24/7. And it wasn't like that. I mean, we, ancestrally, we hunted, we gathered, we moved all the time because we had to. That was how we did life. And we didn't, have all the modern conveniences, which we were saying we both use our washers and dryers.
Absolutely.
We both use our cars, just because that's the way our culture is structured. But I mean, even in Europe, there's a lot more walking that takes place. I've never been to like Japan or places like that, but I feel like it's a lot of the same. We need to move to go places. We don't drive everywhere like we typically do here in our kind of small suburbia. But we just finished a nice long walk, And it was amazing because it was gorgeous today. It still is gorgeous blue sky, and it was so nice, so springy. All right, so best prevention for insulin resistance. What are some like practical things that we can do today that will help us today and tomorrow?
Move. And not, the goal, the American Heart Association recommends 30 minutes a day, 5 days a week. But we don't have to start there. That's the end goal. Jen and I were talking earlier about a half marathon that we did a number of years ago. And I'm a college athlete. I played college basketball and have exercised my whole life. And Jen hadn't.
I did not.
hadn't exercised, worked out. And I.
Not to that degree.
Still kind of question why she's my friend, but I'm kidding. But we decided to do this half marathon.
Yeah.
And Jen.
I was not a runner. I was not a jogger. I had gone, my husband did the half marathon. I was super inspired while he was there, seeing people of like all shapes and sizes crossing that finish line. And I was like, I can do this.
You can do that.
If they can do this, I can do this. Cause I was probably 40. It was a long time ago. And I got super inspired, and she was my running partner, and we started, and it was awesome. But I was not a runner. And so I started on the Couch to 5K program. And you can finish the story.
So Jen had shared later that she got on the treadmill for 30 seconds at a time. And I was like, what?
That was as long as I could run.
I don't think I heard you correctly. But she started. And I use Jen in my office all the time as an example for my patients. Like, I don't care if it's you walking out to get the mail. I don't care if it's you using the stairs to, go down to the second floor when you're out shopping. I don't care what it is. You just need to move. And it could be incrementally, very small incrementally, but you need to start. Start somewhere.
Yeah.
Give yourself a goal that if you're going to go out to the mailbox, you walk out to the mailbox and back for the first week. And then walk out and back twice the second week. And out and back 3 times the third week. But just start. We are made to move, and it's my opinion, and of course I'm biased because I'm a doctor, but it's my opinion that our quality of life is so dependent on your health.
Yes.
So dependent on your health. And when we don't focus on our health, our quality of life as a result is diminished. And the other component that I would comment about is that we really need to pay attention, especially women, to hormones.
Right.
There are a lot of hormonal imbalances.
We just had some people that are talking about that. So listen, Donna, if you're still on, Becky, Sherry, and then there's Rosalie, who's lost 100 pounds. Isn't that amazing? That
is awesome.
Yeah. Okay, so women and hormones.
So there are, so I'm an allopathic trained physician. I went to University of Washington School of Medicine, and unfortunately, sometimes we approach things, or are taught to approach things, to not identify the underlying problem, which is not good medicine, in my opinion. But there are some things that we don't know or understand completely about the body because it's so miraculous. Like, we are so
we're intricate.
Yeah, we're inept about all of the functioning, honestly, of our body. But what we do know, we need to make sure that we identify the underlying problem. And sometimes hormones impact metabolism significantly, just like for polycystic ovarian syndrome. That triggers insulin resistance significantly, and there are treatments for that, which do not include suppressing your whole reproductive system,
right?
Which is how some people are taught to treat that. There are some procedures, like you can have a partial ovarian resection, where they take out a pie portion of your ovary and you stop making as much estrogen, and that contributes to less resistance and really cures sometimes insulin resistance. A NAPRO medical consultant. NAPRO is a form of natural family planning, may be helpful in that circumstance, but finding the underlying problem is really important to address any problem, not just insulin resistance.
Right. And our hormones, I remember learning the endocrine system, trying to learn the endocrine system in college, and it was hard. I mean, it was by far the hardest chapter or unit that I had as a nursing student years and years ago. But cortisol plays a role, right? Estrogen for women. So cortisol rises with stress, which includes not sleeping well, which women struggle with sleep, right? So
especially when you get older.
Yes.
That's one. Insomnia is one of the menopausal signs.
Right.
There are 4 of them, but that's one.
Right. Mm-hmm. And so that increases cortisol. And so, but what I do know is that for me personally, when I exercise, I sleep better. And my stress level is low. So I feel like it just sort of all comes back to moving our bodies. Mm-hmm. It's just as simple as that. Like you said, I mean, biologically, we're intended to move our bodies on a daily basis, and keeping your your stress level as low as you can, sleeping as good as you can at night. And it's hard. The covers are off, the covers are on, the covers are off, the covers are on, because you get hot, and all of those things don't contribute well to sleep. Do you have any advice or sleep hygiene things that you share with your patients ever if they complain about that?
Well, certainly exercise is a component of it, and sometimes hygiene can be something like you make sure that you get quality sleep even for a week. So you use an aid, you use melatonin, you use Benadryl, mm-hmm. To get quality sleep, to kind of reset your circadian rhythm and your sleep cycle, get mm-hmm. that reset. Try that for a week, mm-hmm. and then see what that does. But you need to move in addition. Right. Moving is really at the base of everything. I mean, movement helps protect your heart. It exercise
your muscles,
your lungs.
Yeah.
Yes, there isn't one system in your body that doesn't help with movement.
Yeah.
Your mood is elevated. We have natural endorphins that are really. I mean, movement really is a key.
Kim also had mentioned earlier when we were talking about movement after you eat. So the simple process, especially all of you who live in nice weather every day of the year, about taking a short walk, 20-minute walk after dinner or after meals, 15, 20, whatever. And why is that helpful? How does that help us with our digestion and our insulin and all of that?
So insulin, as I stated earlier, is the key that lets sugar and everything that we eat. When you eat a carrot, you get vitamin A, vitamin C, get some potassium, but that carrot eventually gets broken down into sugar. Yeah. And sugar is the main fuel source for all of our cells. But when you take that walk after a meal, your muscles don't need any insulin to get the sugar inside their cells. So you're lowering your blood sugar with that walk. Anytime that you move, your blood sugar gets lowered just because your muscles need that energy to function. And your pancreas, which is tired in resistance, gets a break, gets a mini vacay. And that's really important to preserve its function.
Because your muscles take up sugar without needing insulin.
Yes.
I love that.
Yes. Simple,
right? You guys, this is simple. I'm gonna look at some questions. LDN is low dose naloxone. It is a therapy used for people that have autoimmune disorders, and I know you use it. Do you use it in your practice?
Not a lot now. I use it in my office in Spokane for women who were trying to conceive, and it does have anti-inflammatory effects.
Right. Mm-hmm. Okay, so back to Donna. You have a terrible time losing weight and you drink ketones. So Donna, as you're learning, like we are not a math equation. Our bodies aren't math equations. They're science experiments. They're intricate. There are a lot of factors, but I would make sure you're drinking water, doing all the right things. Make sure you're drinking water. Make sure you're moving your body. Make sure you're not, especially with keto, I think people get sort of this disillusion that I'm eating keto so I can eat as much as I want of any of the foods that have no carbs and I'll be fine. That's simply not true. It is very possible to eat too much of a good thing. And then calories, they do make a difference. They do. So I would just say keep drinking your ketones for sure. And keep track your food if you're not, because I think that's helpful. Move your body, drink your water, work on your sleep.
And be aware. So
be aware.
If you're tracking, there are lots of free online resources. In my office, when I was in Spokane, I would recommend that my patients use MyFitnessPal because we could pull that up in the office and review what they were doing. But when you open up a packet of M&Ms, it's 320 calories, and it takes
and it's 2 servings.
running, and you have to run. I would have to run for 30 to 45 minutes to get rid. Is that 30 seconds, a minute and a half consumption worth that 30 to 45 minutes of exertion later?
Right.
Like those tangible things that we just don't think about when we're putting things into our mouths, but we are what we eat.
Right.
And it's just really important that we respect our bodies enough to be aware and learn about what it does. And everybody's different.
Yeah.
One thing might act differently on somebody than somebody else. But what your job for your health is to learn how your body functions, and trust that, because your body will tell you what it needs and what it doesn't need.
Right. So good. Becky, that applies to you too. I hope you were listening to what we just said for Donna. Lynn, does the ketone pill really work? I don't know about ketone pills. I'm a huge fan and a promoter of exogenous ketones that come in powders. And I think I have a picture. I'll show you guys this. I am a huge fan. And I just got a picture from a customer last night that I love and adore. She has lost, I haven't showed you this, 35 pounds in 3 months. Can you see that picture? So that's her before and after. The reflection's really bad. She's just a young thing, but she's a mom of 7. She had 2 sets of twins, and then 3 others. But she, and she's done that with ketones and just following a low carb diet. She's not doing keto. She's just, she's an amazing girl. She's retired Navy. Now she works in Houston as a border patrol. So she's just awesome.
And carbs, let me just say something about that quickly, Jen. Carbs, as I described the carrot, you get nutritional benefits. Vitamin A, vitamin C, potassium.
Carrot.
Yep, the carrot. But when you eat a carb, rice, potatoes, pasta, bread, those are the things that I normally counsel about in my office. They go to sugar like that. Very little nutritional, really no, but I always say very little because we need nutritional benefit to you. And so it's really important that you're aware of that. And I never tell my patients, completely eliminate just because I can't or don't, but reduce. Just be aware. Yeah. Be aware of the choices that you're making, and know that those choices are impacting your health, even if you can't feel it.
And little decisions add up. Like if you decide not to have that cake at your coworker's birthday or retirement celebration, it's not easy. That is never an easy decision. And you can decide to have it. That's up to you. But deciding not to empowers you for the next time you have to make a hard decision. Or saying, I'm going to skip when I have my eggs and bacon and toast in the morning, I am going to skip my toast. I'm going to have eggs and bacon. I'm going to set, like, one of the worst breakfasts you can have for yourself is cornflakes, fat-free milk, orange juice, and Yoplait yogurt. I mean, you set yourself up for this huge insulin spike and then a giant crash, and then you're hungry in 2 hours.
Well, and
your brain doesn't work.
And insulin will be in your body for a couple of hours. So after the spike goes up and comes down, then you have to feed the insulin that's still active because of that 2-hour time span that it functions.
I don't think I realized that.
So you have to feed the insulin from that breakfast for 2 hours, because that I describe carbs as fuel sources, I talk about proteins and about sugars or carbs. If you put a piece of paper on a fire, it's gone. That is a carb for energy. If you put a piece of wood on fire, it's there and it burns for a while. And so it's really important that if you're going to have a carb, that you pair it with a protein so that you don't get the spike that goes up and down. You get this soft. You're still going to get the sugar curve, but it's not going to be this abrupt
spike,
up and down.
right.
And that your insulin is still functioning for 2 hours after. That insulin is going to have this. It's not your insulin curve. If this is your insulin, this should be, or if this is your sugar, rather, this should be your insulin. That's exactly how it should work. And when you have a carb meal that goes up and down, this is your insulin, or your carb, excuse me, and your insulin overshoots because that carb is gone, then you have to feed the rest of that curve.
Oh, that's so fascinating. See, she's so smart. So what about then using fat? Because I have talked about, I have talked to my friends and said, oh, they love the baked potato bar at work, and so they'll put, just a little, they think they're doing a good thing for themselves. So they have this big fleshy white baked potato, and I'm like, you should be putting butter, sour cream, cheese, bacon, like all of these fats on that to slow the absorption of that white fleshy high carb, zero nutritional value but incredibly tasty potato. And because it's going to help with their insulin spike, and the fat's going to slow the absorption of that potato.
It will. Yes,
Yeah.
that's correct.
Yay, I got it right. All right, what other questions? Oh, so Lynn, I don't know if that answered your question, and I don't know if you're still on here, but yes, in my opinion, and the opinion of many of my own personal customers and other people that are on that follow this page that aren't my personal customers, ketones are a fantastic option for you. Anything, they work. You need to work them, but they work. They are not a magic pill, but they are an awesome tool to have in your toolbox that can really, really help, especially with cravings control, energy, focus. They help with sleep. So yeah, yes, the answer is yes. I don't know about the pill you're talking about, but the ketones that I am a fan of have been amazing for so many people. 69, move and eat clean, Southwest Florida. Thank you both so much. You're so welcome, Sherry. Thank you for joining. Hello, Rosalie. I love that you've lost 100 pounds. You are amazing. Hi, Susan from Florida. Sarah's from Montana. Hi, Sarah. Donna, you're good. You were still listening. Hello. Is that Meryl? Is that how you say your name? I love that name. I'm probably butchering it, but I'm so sorry. But it's a beautiful name. Okay, whoops. Sorry, computer issues, you guys. I'm not the greatest. Let's see. We were talking about Addison's and fibromyalgia, keto. Oh, Addison's and fibromyalgia. You struggle to lose, but you're doing keto as much as possible and you're slowly losing. Shirlene, keep up the good work. It is not easy. And like I said already twice here, our bodies are so intricate, and finding out what works for you is really the magic, and moving, as we've discussed with Dr. Hartwig.
And Addison certainly complicates your metabolism, but your endocrinologist, which I'm sure that you see, helps with replacement, but that doesn't mean that you can't be successful in preventing things like diabetes. It makes it a little bit more challenging, but it can be done.
Awesome.
So good job.
Let's see.
Low dose naloxone.
Yeah.
Which can help inflammation. Betty's pre-diabetic.
Having a terrible time. Betty, if you're still on here, you're having a terrible time with what exactly? Losing weight, feeling good, exercising? If you're still on here, please respond and let me know, or let us know what you're having a terrible time with. If you're not, I will message you after this and we'll see if we can get some input. Because I would certainly love to help you or have you get some advice. If you're still on here, Rosalie, what did you do to lose your 100 pounds? I think I know, but I think you should share it. Let's see, lots of thumbs up. Ketones are wonderful. Oh yeah. Is there a difference between doing low carb and keto? Great question, Nancy. So the keto diet was designed, I think it was the early 1900s, for children who were not having a relief in their seizures by the medications that were currently available. So irretractable seizure disorders. And they found that if they modified these kids' diets and gave them lots of high fat, which fed their brains and helped them use their own ketones or build their own ketones, that it crossed the blood-brain barrier and helped their seizures. There are people that still use the ketogenic diet as a medical treatment. So it was never really meant to be a phase or a quick fix or the latest buzzword. I mean, it's actually a medical treatment, but it also can help you lose weight and burn fat. The specifics of the ketogenic diet are like 80% fat, 5% carbs, and 15% protein. So it's extremely low carb, extremely high fat, and moderate protein. So those are the macros, essentially, of what the ketogenic diet is. I don't know, unless you are have epilepsy to the point where no medications are helping you, that anybody really needs to follow that intensely. But it is a great way to start getting some weight off. And then low carb is just, if you think about what an American standard diet carb count is, it's probably near 300. What would you say? I mean, if we follow the ADA guidelines?
Yes, too high.
Too high. Okay, so a low carb diet is not too high. And I would say, monitoring your carbs, tracking your food, keeping your carbs between that 75 to 100 range, that would be a really low carb diet. And you would start to see movement in the scale for sure. You would also feel a whole lot better. Because, I don't eat a lot of carbs now as a general practice. There are days that I do. There are events that I go to that I choose to have that cake on occasion. My daughter's getting married in a couple weeks. I'm going to have cake at her wedding. Things like that. I never feel good the next day. Like, I am so used to not having a ton of carbs that when I do indulge, I don't like the way I feel. And you will notice that you feel better. Your brain feels a whole lot better. When you're in ketosis, ketones are the preferred fuel for your brain. And there's a lot less brain fog and a lot more just really good energy, good mood sort of feeling when you're feeding your body and your brain appropriately. So I hope that answers your question, Nancy. All right. I don't know why this keeps, let's see. I thought you were 20 carbs or less. Yeah, probably 20 carbs or less for keto. I mean, it just depends on how you break up that macro chart. But yeah, that's what they say is 20 carbs or less for keto. I really say 50. And that is part of the definition as well. Primary Addison's here too. Weight loss very slow. This is Laura. Any advice? Keep doing what you're doing.
Yeah, no, it definitely makes things complex. And for those who don't know about Addison's, it's adrenal insufficiency, and the adrenal gland is responsible for salt, sugar, and sex hormones, and it makes it adds a level of complexity that you shouldn't take care of things on your own without the help of your endocrinologist.
Yeah. Had MS. This is Susan. MS, many years struggle with weight loss. Anything on MS that you could think of? No. I know Susan. She's followed me for a long time, so she is under the care of physicians, and she's actually a former nurse.
Yeah. So we don't understand MS very well, and so that makes things challenging. But there are some general measures, like we've discussed about, paying attention to your carbs and being active, that would help with really any medical condition. Mm-hmm. Hormonal influence might be helpful, and most OB/GYNs treat symptoms of menopause and not a lot else. So a functional medicine provider might be of help to look at look at your hormones. That can be something. And that's a practice that I used in my office while I was in Spokane.
So some functional medicine, and I'm sure you can find something, Susan, in Florida. I'm sure there's a lot of functional medicine practitioners out there, actually. I love functional medicine. I think it's so cool. All right, we have been on here a long time. Thank you guys so much for hanging with us. I think it's been great. So just to wrap it up, I think the overlying message is respect yourself and your body enough to monitor what you eat well and move. Right?
Yes.
Anything you want to add to that, Dr. Hartwig?
No.
Okay.
I think movement is more important than I think that we appreciate, and we're made to move.
Yeah.
We need to move. However little, you just need to start.
Start. That's the key word, start. I'm going to just make a post that says that, start. All right, you guys, thank you so much again. And thank you, Kim, Dr. Hartwig, for being with me. That was so much fun. I can't wait till she comes back. We're going to do more. Have a great rest of your day. And I think I'll be back cooking something delicious because I have a guest for dinner. So we're going to have to figure out something to do. So awesome. Yes, Susan, hydrate as well. Awesome, you guys. My video is shareable, Carrie. If you just hit the share button, you definitely 100% can share it right now. So I would love that. Thank you again so much for all the likes, shares, comments, follows. Still trying to figure out what to do with my Facebook situation, but I'm managing the best I can. So I'll keep you all posted if I have to change this up. Have a great day, you guys. I'll see you later. We'll talk to you soon. Bye.